plateau as 90% of students who write these exams. Also, when we get these resources, then we are faced with NBMEs and assessment scores in order to predict our readiness for the exams. Now, many people get to the stage where, one, they may not be passing the NBMEs, which are the assessment scores. Two, they may be passing but with a very low score. Three, some may just plateau and they cannot go beyond a certain point. Somebody may study for 1 month and still just make the same score, or even drop, or just make about 5 points difference. So this is what I'm going to talk about in this video, how I managed to move from failing the NBMEs to passing the NBMEs. Then in the next video, what I will talk about is how I moved from just passing the NBMEs to my final scores that took me into the step 1 exams, like the scores that I was getting before I finally went and sat for the step 1 exams. And then so if you can see this NBME, it's NBME 19. My score at that time was 140. This is a raw score. And then if we look down to convert it into the 3 digits, step 1 score, 140 would be equivalent to 153. So I got 153 at that time. And even before this NBMEs, I was scoring lower. It was very frustrating. It took me a very long time to even reach this level. But then after like 2 months, I went back to take NBME 17. I took NBME 17, and then there was an improvement in my score, 300 raw score. And then if I go down, 300 is equivalent to 186. I was still not passing my NBME, but there was a little improvement. So now, how did I move from this level to the next level where I never failed the NBMEs again? I was always passing, but still I was not getting my desired score. So from here, I went on to the next NBME, which was NBME 22. In NBME 22, I got a 216, which is an improvement. Next, I did NBME 23, and there was also here, this is it, NBME 23 also. I'm passing my NBME, so it's good. You can see this is a pass mark, and I've gone beyond the pass mark and just a little bit beyond it, which is not very good because most students are scoring 231. And next, I did NBME 24. I did NBME 24, and this is the NBME 24. And the pass mark, still I barely performed over the pass mark, and most students are still in 231, and this is my score over here. So in this video, I want to show you what I did that moved me from the low scoring, that is this around this side, failing the NBMEs, and what I did to cross over here. And then after doing these things I'm going to tell you in this video, I never went below the pass mark. I was always in this area. So now the next thing I had to do is just to move towards the right. That's all I was doing, and I never went below. So in this video is supposed to help those who are not passing the NBMEs be able to at least pass the NBMEs. Then in another video, I will show you what I did from this area in order to cross to this area. For example, if you look at my NBME 29, I got 246. So I'll show you how I transition from passing the NBME and also now going above the average or even close to the average. So let's continue this video. So one thing that I did was that I was sincere to myself. So after I realized that I was not passing the NBMEs, I sat back and asked myself, what is wrong? What am I doing differently? So what I did was that I sincerely told myself, okay, I don't really understand certain things that they ask. So I went back into my basics, and then I'm going to talk about some of the topics that I went back to read. I read them very well. I watched B&B videos on them for explanation, and that helped me very much. So these are some of the topics. It may be something that is working, that may work for you too, because these are topics that I got a lot of questions from when I sat for my my step one real deal. So I would like you to also look at them, and if you don't really understand these topics, then these are some of the things that may be holding your scores backwards. So what I did first was that I decided that, okay, let me take B&B and take the first aid. So when you look at the first aid, we have some basic pathology that I decided to do. So I did some basic pathology, and then I did some basic pharm, and then also I did some endocrine, some brief endocrine. So these three topics were the game changer for me. But then how did I do it? I'm going to just list some of the topics that I did that were the game changer. And after I understood these topics and I was able to apply them on in questions in UWorld and also NBMEs, it got to that point where I never failed an NBME again. So if you are failing your NBMEs, if you've plateaued, then these are some of the things that you want to also study so that you can break that chain. So the first thing that you want to understand is that you want to understand cellular injury. Cellular injury is very, very basic to all disease processes in the body. You have to understand apoptosis very well, and all the things that happen, all the sequence of events, the extrinsic, the intrinsic. You have to know every single detail of the apoptosis pathway. For the purposes of this video, I cannot go into the details of lecturing it, but what I'll advise is that go to B&B and he will take you through it. Just open the first aid, open B&B video on the set topics, and then go through it. Now, necrosis is the next thing. You want to understand necrosis very well. Let me see if I have it here. Let me see some. Yes. So talking about apoptosis, you want to understand the intrinsic, extrinsic pathway, the cast spaces, understand them very well. The perforins, you have to understand the granzymes, how they work, understand each of them very well. The BCL2 overexpression, what it will lead to, understand that very well. Cytochrome C, what it does, you have to understand it very well. If you don't understand it, then you are not anyway ready. You have to understand amyloidosis, how amyloidosis occurs, how amyloid will deposit in the body, and how it comes about, what conditions can cause amyloids to deposit in the body, and then when it deposits in other in some tissues, like when we do the immunohistochemistry, how would it show on a tissue sample? You have to understand that. The next thing that I did was that I looked at inflammation, because we may think that we understand the topics roughly, but then NBME and the boards, like what they want is that they want you to vividly understand every single detail of these topics. They don't want you to just have a general knowledge about it, but in order to pass step one, you have to know the details and you have to know everything on point. So you have to understand acute inflammation. I went back to do acute inflammation and all the inflammatory reactants. So when there is inflammation, there are certain things that would upregulate, and then the mnemonic is more fish in the sea, and then you can see it over there. You can see it in the book. Let me see. I don't know if I see them here. For the purpose of this video, I don't want to waste so much time into looking for these things in the book. So what I'll say is that you have to know them. Your inflammatory reactants or inflammatory cytokines and all those things, you have to know all of them. You have to know those that are down regulated, those that are up regulated, the TIBC, albumin, and co. You have to know what happens to them. Procalcitonin and ferritin and co. You have to know exactly what happens to them, understand it very well. The light criteria is the next thing. If somebody has an exudate and transudate, how you will be able to differentiate whether the person is having an exudate or transudate from the LDH and other parameters that are given. You have to really understand it and know how to calculate it, how to calculate the light criteria. The next thing that I did was mediators of inflammation. You have to understand that the interleukins, know all the interleukins, the mnemonic hot, T, bone, ache, interleukin 1, what it does, interleukin 2, what it does, interleukin 3, 4, and up to 6, what they all do. You have to know them. Prostaglandins, and then leukotrienes, which are from the arachidonic acid pathway. You have to understand it from the cell membrane, and then even arachidonic acid, like what it is coming from the linoleic acid, which is from essential lipids. So you have to know that it's incorporated into the cell membrane. And then anytime there's injury, we break it down, and then the enzymes convert them into leukotrienes and also interleukins, and this help in the inflammatory process. You have to know everything in that reaction, whereby you have to know which drug block what, and if aspirin blocks some side, everything will shift to the other side, and what will be the consequences. These prostaglandins, we have different types, what happens to each of them. You have to understand, apply them to labor. You can apply them there. You can also apply them to our GI and even wound healing. So understand this very well. You can apply some of this also in immunology. Understand that. So I did this also. Then there are some basic principles of leukocytes, where neutrophils shift to the left, shift to the right. Understand it. If you don't understand that, yes, you can just type a message to me in the comment box, and I will explain that to you. It's very simple, but you have to understand it in order to be able to go confidently into your step 1. Leukocyte extravasation, like when there is inflammation, how leukocytes move from the bloodstream through the blood vessel to the site of inflammation. You have to understand, and the sequence of events that happen on the way when they are going. You have to understand that. You also have to understand neutrophil migration, when neutrophil is migrating to the site of an infection, like whatever happens over there, and then all the diseases that can occur, like the leukocyte adhesion disorders. You have to link them up with this topic, so that when you are faced with questions, you can apply them. NBME really loves the leukocyte adhesion disorders, because I met similar topics in my real deal, and then if you understand them well, then choosing answers will be very easy for you. So the next thing is wound healing. You have to understand all those mediators. For example, fibroblast growth factor, what does it do? Transforming growth factor B, what does it do? Next is VEGF, platelet-derived growth factor, what they do during wound healing. You have to understand this. Metalloproteinases, how do they come in during remodeling of wound and scars? And epidermal growth factors, what do they do? You have to find a way to memorize all this, because they show up. You will meet them on your step. You will meet all the things I'm talking about. You will meet a question on all of them. And if you are not really well vested into this kind of topics, then you are actually not ready for the exam, because these are basic principles, and most questions come from these things. Now, changes in collagen and cells and scar tissue. So after a wound has healed, even let's start from when somebody has a wound or a cellular injury, like what happens on each day. So day 1, what will happen to tissue changes? Day 5, what will happen to tissue changes? Day 3, what will happen after 1 month? What will happen after 3 months? What will happen? You have to really understand that. And then what enzymes that mediate changes from, let's say if somebody has a wound, and then the wound has healed, and then collagen has deposited. We know collagen, we have type 3, we have type 1. So what the transitioning from type 3 to type 1, like what enzyme mediates that? You have to really understand that. Granulomas, we must understand granulomas, because it's very, very important in many disease processes. So you have to know the caseating ones. TB and fungus are those that cause the caseating ones, and then the non-caseating could be all other things. You have to know these basic principles. You have to know that the process of formation of granulomas, what cells mediate it, from your antigen presenting cells to your T cells to macrophages. What do they secrete? So your antigen presenting cells will secrete, let's say, interleukin 12. Your T cells secrete your T cells, like what would they also secrete, and then your macrophages to what would they also secrete in order to form the granuloma. So please understand all these basic principles. They are all in the first aid, so just pay attention to them, and you will start passing your NBMEs, because these are the kind of questions that they ask, and when students don't know it, like we don't perform very well. Now, the next topic that I did was principles of neoplasia. Principles of neoplasia, very, very, very important, because over, like, let's say 1/4 of the population of America have a kind of neoplasia, either a cancer or like or maybe a neoplasia going on in one way or the other. So it's very important in to the population of America. So let's take that neoplasia very serious. We see it every day, and then we even misdiagnose them in the hospital. So tumor progression, how tumor develops. Let's say after, when the tumor grows, how does it spread? So down regulation of E-cadherin is something very, very important that we have to look at. Unfortunately, I don't know whether I have these pages open up, but for some reason I don't want to, but they are all written in the first aid. Everything is written in the first aid. You just have to understand them and read them very, very well. So yeah, down regulation of E-cadherin being the first, and then attachment to laminin in the basal membrane is the next. Then they produce metalloproteinases, and now they attach to fibronectin. You have to know all these things like at your fingertips. That is one thing they ask a lot about it, and then you meet all these topics I'm talking about, market and hallmarks of cancer. Like, if someone has cancer, what are some of the hallmarks of the cancer? So how cancer survives in the host defense. So for example, like if I have no, I don't have cancer, sorry. So if somebody has cancer, like if someone has cancer, what mechanism does the cancer cells put in place in order to evade the host mechanism of defense? There are many things, and then you have to really, really understand them. They are written right here in the first aid, and you should find them and then study them very well. Cancer epidemiology, the types of cancers that are found in each body, each population. So women, breast, and then men, prostate, they all have lung cancers. Which one causes more death in both of them? Both of them also have colon cancers. So you have to understand that cancer epidemiology. This topic, very, very important, very, very important. And also common sites of met. So if someone has cancer in, let's say, in the liver, where is it likely to met to? Now, if somebody has cancer in the let's say it's this way rather. If somebody has a cancer in certain tissues, like where are they likely to met to? So that is what you want to understand. And then the topic is common metastasis, common mets. So bone cancers, like where, so the site of met, for example, if the site of met is bone, which cancers love to come to the bone? Now, which cancers love to move to the liver, and which cancers love to move to the brain? You have to understand this, form a mnemonic of each of them, and then you have to know the commonest ones, the second most commonest. So you form a mnemonic so that if it's not this, it will be the other. That topic also, you want to really understand which of the cancers will show blastic forms or sclerotic forms on bone, in the bone, and which one also show a lytic mass in the bone, or which will show mixed. So understand that very well, very important. I cannot stress enough on that. Please understand, because you will meet questions on them, both in your UWorld, both in your NBMEs, and in the real deal, you will meet question on it. So that's about the site of met of cancer. Now, oncogenes, I cannot, like, you cannot study without knowing oncogenes. Like, you have to know the proto-oncogenes, you have to know the oncosuppressor genes. Also, all the genes, you have to play with them, find a way to understand it. It's complex, but it's not super hard. It's not something you cannot do. So find a way to understand the oncogenes, learn them, and then you can break those chains of not just learn and apply them on questions, so that when you see this oncogene, you know whether its deficiency is going to cause a cancer, or whether excess expression of it is going to cause cancer. So the proto-oncogenes, when they are overexpressed, they cause cancer. The oncosuppressor genes, they are naturally supposed to suppress cancer. So when they are downregulated, then the cancer will develop. So understand these basic terms. Now, tumor markers. Tumor markers are very, very critical. Tumor markers, as soon as they mention alpha fetoprotein, beta ACG, they mention LDH, chromogranin, PSA, they mention CA19-9, CA25 calcitonin. You have to know what type of cancer it is. You have to just know it off head, because in the hospital, the lab people, they'll just call you and tell you maybe the preliminary results of a tissue test, or the histochemical marker of the cancer tissue that was taken. So as soon as they bring that, you don't wait for the final results to have an idea about what the cancer may be, because most of the time when we take a tissue biopsy, the patient will be discharged before you even call them and confirm the real cancer to them. But as a doctor, these tumor markers help you to have an idea about what the result is finally going to be. That is why it's important we know them. So understand immunohistochemical studies, so that if any tissue, let's say if it's S100 positive, if it's PSA positive, if it's GFAB, if it's desmin positive, you should know what tissues that we are talking about, and that can give you an idea of what kind of disease or cancer that we are talking about. Now, one of the most important things that you will meet about 2 or 3 questions in your real deal or even NBME is paraneoplastic syndrome. Paraneoplastic syndrome. You will always meet questions on the high yield ones. You have to know the difference between the dermatomyositis. You have to know how to differentiate dermatomyositis from polymyositis. You have to know the lesser Trellet sign, what it indicates. Very important. Hypertrophic osteoarthropathy. You have to know that. You have to know tumors that produce hypercalcemia. You have to know, and then their descriptions. You have to know. You have to know these 2. I wrote them down. Very important. All the neoplasms associated with thymic mass. So if somebody has a thymic mass, what conditions are associated with thymic mass? You have to know. I formed a mnemonic if you care to know. They are called, I call them thymic GMP, whereby you have the good syndrome, you have myasthenia gravis, and also you have the pure red cell aplasia. You have to understand these things very well and apply them. If they say Lambert-Eaton versus myasthenia gravis, like, you have to understand that Lambert-Eaton is small. It's from small cell lung cancer, and also myasthenia, it will be from a thymic mass. So understand this. So all the the paraneoplastic syndromes, you have to understand all of them, apply all of them, all the things that can be caused by small cell lung cancer. And you have to understand. It's very important, please. I cannot stress much enough on this. Now, so these are the basic pathology things that you want to understand in order to perform well on your NBMEs. Now, the next thing that I moved to was my farm. My farm was a little shaky. I didn't really know the basic farm, because I thought the farm was just about knowing the medications, but that is not enough. The basic farm is very important. Understand competitive and non-competitive inhibitors. Understand their diagram, how to draw them several times in order to have a pictorial memory, because on step you will find at least a question on it. Now, those formula, the formula for calculation of half-life, bioavailability, loading dose, maintenance dose, and yeah, you have to know all these things. Okay, so you have to understand these things because they are very, very important. Volume of distribution. Find a way to memorize those mnemonics. Find a way to memorize those formulae so that as soon as they show up, you know how to calculate it. Because in the real deal, sometimes they'll give you some figures. In my exam, they gave me some figures in order to be able to calculate, let's say, volume of distribution. The question will give you some figures and everything and say what is the volume of distribution. So you have to understand how to apply this. If you don't understand this, you are not ready for step. Don't go and take it. Now, next thing is G protein couple receptors. Very, very important. G protein couple receptors. You have to know how to apply this. How to apply G protein couple receptors. The GQ, GS, G stimulatory, and G inhibitory. And then what they do, whether they increase adenyl cyclase or phospholipase C is what mediated, and whether they will make ATP or they'll decrease cyclic AMP or they'll increase cyclic AMP, and what the effect will be. You have to really understand and know which drugs uses these receptors. So understand that very well. That is very important. Now, endocrine signaling pathway. If you go to endocrine, you realize that endocrine also has a signaling pathway. I combine these two, the G protein couple receptors and the endocrine signaling pathway. You realize that the endocrine hormones, each of them has a signaling pathway that it uses. So if you can also memorize that, because they are a lot, and then you cannot go into the exam without finding a question on them. You will always find a question on the endocrine signaling pathway. So take that very serious. By that, what I mean is, if you take a glucagon, histamine 2, and then if you take all the brain hormones, most of them work with cyclic AMP. GMP also has its own, and also those that have intracellular receptors. I can go over it real quick because I don't want this video to go to become too long, but they are there. The mnemonics are in the book. You can use those mnemonics, but I also have my mnemonics if you want them for simplicity, because my mnemonics includes everything. So you can just email me or just leave a comment and I'll drop it below for you. Next thing is drug reactions and then toxicity. So drug toxicity, like if someone takes some poison, like what do we use to treat it? You have to know. It's in the book. It's in the first aid. Next is cytochrome P450, the inhibitors, the inducers, and the substrate. Most Americans have AFib, and then they've put them on warfarin. So you want to really understand drugs that interact with warfarin. If they increase P450, what will happen to the effect of warfarin? If they decrease P450, what will happen to warfarin? Their INR, what will happen to it? And next, HIV drugs. You cannot do this exam without HIV drugs. You can't do this exam without understanding the mechanism of action of diabetic drugs. You can't do this exam without understanding the mechanism of action of lipid lowering drugs, all your statins and all the vitamins and like everything. You have to understand each of them. So diabetic drugs, lipid lowering drugs, and HIV drugs, understand them. Steroid synthesis. So synthesis of steroids. How do we synthesize steroids? So that pathway you must understand, and then if there is any like deficiency of any hormone, you have to know what the problem would be. So these are the things that I sat down and genuinely understood. Like I had to spend time and do this very well, and then make my own notes, make my own mnemonic. At the end of the day, I had this book. So when I was doing, I'll just write them over here, and I will recite them over and over and over again. And that gave me a boost in my step one. So after doing all this, I would never fail an NBME again. So yeah, that is it. I never failed an NBME after going through these topics and then try to apply them on my assessments. So thank you very much for watching this video. I don't want it to extend so much, and I know this is a very serious journey for us. Take it serious, keep reading every day, be sincere to yourself, avoid distractions, keep reading every day, believe in yourself. You can do it. Yes, you can. Every stage in life is hard. This stage is also hard, but remember, all the hard stages, you'll be able to cross them. You will cross this one as well. Thanks for watching this video. I wish you good luck in your studies. Wish you good luck in your prep. Don't forget to subscribe to this video. Don't forget to leave your comments. If you have any questions, any suggestions, just leave it there for me. Also share with your friends. Just leave a little comment for me. Also, when you subscribe, click on the bell so that the next video that I'm going to make, you will be notified. In the next video, I'm going to talk about how I moved from just passing the NBMEs and getting my final scores that told me I'm ready for STEP, and I went in and I passed. Thank you for watching this video. Have a good night. Bye bye.